Hello, and welcome to the Vestibular Migraine by Miranda and Hannah.
To start off with, here's a brief introduction onto what is a vestibular migraine. A vestibular migraine is an association of vertigo and a migraine, and it is so common that it is often debated whether it's a disease or just a variant of the human condition. Here we provide some definitions onto what is vertigo and what is a migraine. A vestibular migraine can, simply put, be a variant version of a migraine, except instead of having a really bad headache or having a headache be the most predominant feature, you feel incredibly dizzy, and thus this is where the vertigo term comes in. As far as symptoms go, people can still get very bad headaches, severe head pain, even though it may not be the most predominant feature. And in fact, in some people, there is no pain at all, but rather just simply vertigo and dizziness and visual distortion and all symptoms related to dizziness. Another symptom that is common with vestibular migraine is sensory amplification, such as to light and sound, to pain, motion and medication, and even weather changes. And although there is a wide range of times that these migraine episodes can last for, they usually just range from minutes to hours.
How does the migraine actually happen, though? Well, I'd like to start off with saying that food and environmental cues play a very big role in the effect of the migraine. Things such as hormonal fluctuation, food stress, sleep disturbances may affect the migraine. Things also like barometric pressure variations, which is atmospheric pressure, and weather changes can also be a effect. But how does the migraine actually happen? Well, scientists say that it's a mixed pathophysiology, which is a connection between the cerebral spreading depression of Leo, which is a spontaneous spreading of an electrical charge along the cortex, and that is followed by an activation of pain receptors located in the brainstem, which is very close to the vestibular apparatus. But how does it actually happen? Well, there's a common consensus about headaches, especially ones such as the vestibular migraine, and the consensus is that it's a mixed pathophysiology, and it basically means that there's a connection between the cerebral spreading of depression of the Liao, which is a spontaneous spreading of electrical charges along the cortex, which is followed by activation of pain receptors located in the brainstem, which is not far from the vestibular apparatus. So the release of the neurotransmitters then lead to the dilation of blood vessels near the scalp and other structures that exist outside the brain substance. So when this happens and when a vestibular migraine occurs thereafter, there's excitability in the brainstem, which overlaps the vestibular structures, which help us keep our balance that cause the dizziness. The causes of this physiological process can be summed into four simple subcategories. Vascular, where patients may experience spasms of blood vessels in the ear and brainstem, which will cause it. Neurotransmitter changes, irregularities in neurotransmitters. Cerebellar disturbances, which is an altered metabolism in the cerebellum. And lastly, sensory exaggeration, where patients are more likely to experience motion sickness or feel the effect of a small amount of vestibular disturbances.
Moving on to the genetics of migraines. Migraine is thought to be an inherited disorder, and a person's vulnerability to migraines or susceptibility to migraines is determined by an abnormal discharge of neurons that affects the brainstem regions, as well as specific genes, such as the CACNA1A gene, that cause a person to have an increased chance of being diagnosed for vestibular migraines. This specific gene, as well as the other genes such as the ATP1A2 and the SCN1A, are all related to ion channels that control how electricity is spread throughout the brain, and thus affecting the chances a person may have to be diagnosed with vestibular migraines. In addition, migraines are actually more common in women than in men, with a 3-to-1 ratio, and more commonly seen in people between the ages of 40 and 70. It's actually so common, in fact, that It's more common than asthma and diabetes combined.
So there's not a single treatment for vestibular migraine yet, but if you are experiencing vestibular migraines, you probably have to abstain from foods such as chocolate, strong cheese, alcohol, especially red wine, and MSG containing food. You're also advised to see an audiologist and a vestibular rehabilitation therapist for evaluation and treatment. So they will collect the history of like your genetics and family, and if the symptoms continue, there would be a large amount of tests so they can like generate a detail-oriented therapy for you. So people who have vestibular migraine usually are treated with antiverginious and antiemetic drugs, but like I said before, there's no control, trial, or treatment for the vestibular migraine that has been found to work. But what they found is that the most effective way to manage a migraine is to combine medications, vestibular rehabilitation, and lifestyle modifications that will include the limitation of certain factors that relate to the migraine, such as food, sleep, stress, exercise, and environmental factors. So, a brief summary of what we've been talking about and what you should take from this is that a vestibular migraine affects a large percent of the population and can be classified by severe head pain and periodic capitation, or in this case, caused by dizziness. Technologies for the vestibular migraine are helping to create and expand new medication and treatments for it. But at the moment, the best way to treat it is proper identification, specific diagnostic measurements, and optimized treatments that will make the best results.